Hello and welcome. Today, we're diving into a complex and concerning condition affecting children, multisystem inflammatory syndrome in children, or MSC. This is a serious heart disease that we need to understand. MSC is a post-infectious inflammatory condition. It appears to be linked to a previous infection with SARS-2, the virus that causes COVID-19. While the exact cause remains under investigation, it's believed that the body's immune system overacts weeks after the initial COVID-19 infection, even if the child had mild or no symptoms at the time. This immune response then attacks various organs and systems within the body. The pathophysiology of MSC involves a widespread and uncontrolled inflammatory response. This inflammation affects blood vessels, leading to vasculitis. The heart is particularly vulnerable. Coronary artery aneurysms, or bulges in the heart's blood vessels, are a major concern. The inflammation also impacts the heart muscle itself, causing myocarditis, and can lead to problems with heart rhythm and the ability of the heart to pump blood effectively. Other organs like the kidneys, lungs, brain, skin, eyes, and gastrointestinal tract are also affected due to systemic inflammation. The process is complicated, and researchers are still working to fully unravel the mechanisms at play. While considered a relatively rare condition, MSC has been observed globally, primarily following waves of COVID-19 infections. The exact incidence varies depending on the region and time period, reflecting the prevalence of COVID-19. MSC typically affects children and adolescents, with most cases occurring in those between 5 and 13 years old. Understanding the epidemiological trends helps healthcare providers better prepare and recognize potential cases. The signs and symptoms of MSC can be diverse and overlapping. Fever is almost always present. Other common symptoms include abdominal pain, vomiting, diarrhea, skin rash, red or cracked lips, red eyes, and swollen hands or feet. Some children may experience fatigue, headaches, or neck pain. Importantly, some symptoms can resemble Kawasaki disease, another inflammatory condition. It's critical to seek medical attention immediately if a child displays these symptoms, especially if there's a known history of recent COVID-19 infection or exposure. Diagnosing MSC involves a combination of clinical evaluation, laboratory tests, and imaging studies. There is no single definitive test. Doctors consider the child's symptoms, medical history, and any known COVID-19 exposure. Blood tests can reveal elevated inflammatory markers, such as C-reactive protein, CRP, erythrocyte sedimentation rate (ESR), and ferritin. Cardiac markers like troponin and BNP may also be elevated, indicating heart damage. An echocardiogram is crucial to assess heart function and look for coronary artery aneurysms. Other tests, such as chest X-rays and abdominal ultrasounds, may be performed to evaluate involvement of other organs. While MSC doesn't fall into neatly defined classifications, it is sometimes categorized by the severity of cardiac involvement or the predominant organ system affected. Some cases may primarily manifest with cardiac dysfunction, while others may show more prominent gastrointestinal or neurological symptoms. These variations influence the treatment approach and monitoring strategies. Treatment for MSC is aimed at reducing inflammation and supporting organ function. Intravenous immunoglobulin, or IVIG, is a common first-line treatment. Corticosteroids, like methylprednisolone, are also frequently used to suppress the immune response. In severe cases, other immunomodulatory therapies, such as anakinra or infliximab, may be considered. Supportive care is critical, including managing blood pressure, providing respiratory support if needed, and addressing any specific organ dysfunction. Children with MSC typically require hospitalization and close monitoring in an intensive care unit. Since MSC is linked to COVID-19 infection, the primary prevention strategy is to protect children from contracting COVID-19. This includes vaccination against COVID-19 for eligible age groups, practicing good hygiene like frequent hand washing, and following public health guidelines, such as mask wearing in appropriate settings. Minimizing exposure to the virus is the best way to reduce the risk of MSC. The prognosis for children with MSC is generally good, particularly with prompt diagnosis and treatment. Most children recover fully, although some may experience ongoing cardiac issues that require long-term follow-up. Coronary artery aneurysms can persist and may require medication or, in rare cases, surgical intervention. Ongoing research is focused on understanding the long-term effects of MSC and developing more targeted therapies to minimize potential complications. Studies are also exploring genetic predispositions and risk factors that might make some children more susceptible to developing MSC after a COVID-19 infection. It is thanks to advances in research that we can understand the disease better and improve patient outcome.